Where your records and see now you can do all that stuff.
Oh yes, okay. Gee. Okay. Mute all, including myself. All right, good afternoon, everybody. My name is Whitney Nordvold, and I am the program coordinator for the Great Plains Park. I'm sorry that I don't work under that program anymore. The Great Plains Good Health and Wellness Program here with Great Plains Tribal Chairman's Health Board. And we would like to thank you all for attending our community health webinar today. And today we have presenters from the Northwest Portland Area Indian Health Board and National Indian Child Welfare Association. And they're going to be talking about components of a tribal policy toolkit. I just wanted to note a couple things before we get started. We are recording, so if you would like to receive a copy of this recording, or if you would like to be on our mailing list for any future webinars that we're hosting, please put your email address in the chat box if you aren't already on our listserv. And then please mute yourself so that we can reduce as much background chatter as possible so that we can hear our presenters. And unfortunately, I have not had the honor of corresponding with these folks, so I'm going to let them introduce themselves. I don't want to slaughter anyone's name or introduce the wrong person. So I will just hand it over to you guys. And if you need help taking over the screen or whatever, we can walk you through that if you need help with that. But you guys should be able to unmute yourselves and just go right ahead.
Awesome, thank you. Can everybody hear us okay? Yeah, okay. I got a thumbs up, so I guess that's good. We're gonna go ahead and share our screen. That way you can see our PowerPoint, and we'll go through and we'll introduce ourselves. Yeah, so we're all represented in the same room. So we may have to move around our camera a little bit just so everyone can see us. I'm gonna share our screen.
the Cancer Prevention Coordinator, and I do a lot of work around tobacco education and prevention policy work, and I work closely with 9 tribes in Oregon, and there's going to be 4 of us actually doing this presentation for you today, and we'll just kind of go around and present ourselves individually.
Good afternoon, everyone. I'm Adam Basinti. Jag är Adam Basinti. Det är en Janine Schlitz and I've been glad you're able to join us. I'm with the National Indian Child Welfare Association as a community development specialist.
Hi, everybody. My name is Ryan Sealy, and I am the Tobacco Prevention Coordinator for our tribes of Oregon, Washington, and Idaho. And I work primarily with policy, systems, and environment, but also do a lot of community education.
Tatsmewi, everybody. My name is Nora Frank Buckner. I'm an Nez Perce tribal member. I work at the Northwest Portland Area Indian Health Board, also on the Good Health and Wellness in Indian Country project. I am our project coordinator.
This one? There we go. All right, so I'm just going to go over some objectives for this presentation for you guys. And mostly what we're going to do is kind of review the policy toolkit contents and then go over a little bit of tools and resources. And then mostly discuss the theory methodologies, policy phases, and next steps. And before we dive into this, I just wanted to say how we got here today. And Ryan and Adam were able to attend NIHB and present there. And that's where they ran into Shannon, who actually got us to be on the webinar and present to you guys today. And this is our lovely team, more of our faces in case you can't see us right now.
So when this project came together, I was working with a lot of tribes with tobacco around, like I said before, the policy, systems, and environment. And what I was running into, that a lot of the tribes wanted to create their own policy, but they didn't exactly have all the tools to do it. Like a lot of policy has been done in their communities, but sometimes taking on a new role, if you've never done that before, is a little intimidating. So I started working with Antoinette in just developing a couple really basic resolutions and policies that the tribes could sort of input their names, and we could ask them like what they wanted in there. But what we found too is that sometimes doing policy requires more than just asking somebody to change a policy. And sometimes you have to gather information, find out where the community, if they're ready, and what their buy-in is. So what I decided was to include Nora too in this project, because she works with a lot of tribes who want to do policy around food, whether that's in the community or actually food systems and stuff. So we started working on this toolkit together, and we presented on it. And then Adam came for one of our presentations and had said that he was really interested in working with us because he had started working on a policy guide for the systems of care. And so it just made sense for us to have more of a collaborative effort to work together and get more perspectives from different populations working with everybody. So this is how the whole group started. So here at the Portland Area Indian Health Board, you can see here, these are our tribes that we serve. There's 43 of them. And although we do not work for the American Indian, Alaska Native urban population, we do sometimes collaborate with them, and we definitely share a lot of resources, but our primary objective is to serve the tribes of Oregon, Washington, and Idaho.
All right, so we'll just go ahead and get diving into our guide here and kind of give you a background on where we're coming from and how we framed it while we were writing. And in tribal communities, policy is definitely, or usually it was unwritten, and known as more as tribal protocol, customary or natural law, or more community norms. And our tribal policy guide is based more on how it will benefit the greater community, including youth and elders, how it honors and reflects tribal beliefs, values, principles, and practices, how it maintains or restores harmony and balance within the spiritual realm, and how it provides for our next generations to come. And we'll talk more about the model that we use while writing this later on in the presentation. So the purpose of our toolkit was really to support tribal community-driven policy, provide a guide for tribal nations, communities in the policymaking process, offer ideas, concepts, and structure relating to how tribal communities may approach policy, and highlight and honor tribal perspective for policy development. So we really focus on the community and making sure that when you're developing policies, that they really reflect the ideas and the solutions from the community's members. For utilization of the toolkit, it's really to be a guide and asking yourself, is policy really the best course of action? And we'll talk about that when we look at the phases that we put into our toolkit. It's addressing the community's needs and making sure that you're doing it in a way that empowers the community and that you're giving the community a sense of ownership over the policies. And that's really going to help ensure the policy's success and effectiveness. And advocacy and education for partnerships, both tribal and non-tribal. You can use it as a way to look at it through a tribal lens or a holistic approach that respects the values and the perspectives of your community. And it's a way to honor and practice our tribal sovereignty and self-governance.
So when we were looking at writing this policy toolkit, we kind of took the perspective of using that multiple people would be using this and have a wide range of users. So our target audience was more of tribal communities such as tribal council, elders, tribal workers, and even youth. So this is very user friendly. And we also thought it could be a great resource for Native and non-Native partnerships and state, county, and federal agencies. And this was mostly based on where policy could be the solution. And in the policy toolkit, we even have a place set out for maybe policy may not be the solution within your community. And we kind of wrote out little steps there that way as well. So this is mostly for policy as the solution. And so kind of like what Nora mentioned before, as policy is kind of more of a customary law, a tribal protocol, a community norm, which are other non-traditional forms of policy. It's, policy that's not written in form. So it's not always a piece of paper when it comes to tribal communities. And we wanted to make sure that when writing a policy that we incorporated philosophies and the belief system into your policy, such as using your own tribal language and tribal roles throughout the community, men and women's roles, youth roles, elder roles as well. And talking about kind of putting that spin on it to kind of make it apply to the more modern day context of policy. So it's more what Nora said, community driven versus state driven.
When we started working on this toolkit, we brought a lot of perspectives and experiences together, and I feel that one of the patterns, or one of the things that we had in common, was that we all wanted to bring a tribal perspective and a lens that connected with the tribal communities that we work with. And I have been working with system of care tribal communities and utilizing the relational worldview model. And the relational worldview model was developed by NICWA, that's based on indigenous thought and ideas. And is also very similar to a variety of cultural or traditional models, such as the four directions, or the medicine wheel teachings of various tribes and within the Americas and First Nations. And so we thought utilizing this holistic, this strength-based tribal perspective is a framework to sort of ground our toolkit in and have it serve as a way or a means to guide tribal communities in the policy process. And so we start developing and really looking at this model of how it could work within the policy process. And of course, trying to think about policy and indigenizing that and trying to see it through the relational worldview is what we try to do. Because again, what we wanted to do is take that the concept of policy and how does it look like within the traditional or the cultural traditions of our communities, and what did it look like on the ground. And so what we are trying to do is again, have that sort of be a way to, as an organizing construct, I guess, having the relational worldview be that organizing construct and structure to think about policy. And of course, this is, again, strength-based. This is relating to a lot of tribal beliefs and values and even perspective there in thinking about things holistically, thinking about things that are, fluid, cyclical, that all describe the relational worldview within the National Indian Child Welfare Association. And so in my work, I often use this model as a means to assess tribal communities of imbalances and to be able to also identify strengths. So there's the application certainly is diverse, but historically it has been used as a means to have the quadrants within the context, which is environment, mental, body, and spirit, come into balance or harmony within one another in order to find health, in order to or be healthy and be centered and to have a sort of healthy lifestyle. So as some of you folks may be familiar with, this particular slide here explains what's within the four quadrants and what we started as our foundation. So the context, of course, is everything that's outside of you and is the environment there. So we talk about work, school, community. The mental piece is all the cognitive aspects of yourself. The body is all the physical pieces there. And the spirit is sort of those learned practices that are positive, could be also harmful. And then we have those metaphysical or spiritual forces that are also at play that are positive, but also could cause harm. So historically, the relational worldview was utilized as a means to balance an individual within these quadrants here in order to find health or to be healthy. But then the National Indian Child Welfare Association took this further and developed an organizational level where it represents the environment, it represents the infrastructure, resources, and mission. So if you're looking at the environment, looking at, again, everything that's in the environment of an organization, the infrastructure of an organization, the resources within the organization, which are people and funding coalitions, and then the mission, of course, is what your values are as an organization. So just like the individual and family level relational worldview levels, the organizational level is based on the balance and harmonious relationships within the four quadrants here. And mind you, there is interdependence, of course, amongst these four quadrants here. So changing one thing impacts everything. And that's aligns with tribal thought in regards to interconnectedness and also the holistic perspective tribal people understand the world through. So utilizing these this framework here, we then developed community quadrants, and utilizing that sort of organizational level, looked at utilized the relational worldview framework through the community aspect. And so what you see here is the four quadrants representing the community environment, the community infrastructure, community resources, community mission. And so this is ideas that we developed that we feel are that popped out at us in regards to what is within the community environment. Well, the social, political, the cultural environment, and so these are not set by any means, but really just put down. We put down ideas about what are some of like the obvious forces or factors that are in the community quadrants here. And so when we're looking at this, what we were thinking in regards to moving forward in the policy process, or even are you thinking about developing a policy? Are there imbalances within the quadrants that maybe start the initiative to go in that direction of developing a policy? And what we are trying to understand, or at least view problems or issues through, is again those imbalances. So our whole framework is again restoring the imbalances within your community, which could be through a policy. So that's the approach that we're taking in our thought process in this toolkit here. And so in regards to a balanced community, that's going to mean all of these community quadrants have sort of a harmonious relationship with one another. So obviously a great economic environment might provide for strong infrastructure and might also, again, lead into a positive, resources for the community, for people, and then be fulfilling the mission of sorts there. And now when we're thinking about, say, an imbalance, so again, if you have a challenge or an issue in the community, we're looking at it as an imbalance. So obviously social, political environments that are maybe harmful, or there is somewhat of a challenge in there, maybe poverty, that often impacts everything. So we're looking at that as an imbalance there. So that's what we are putting in this toolkit, is this sort of framework that looks at the policy maybe imbalances and challenges, or at least looking at also policy creation through this particular holistic lens. So I'll go to the next slide and then bring up some questions and also some examples to kind of help with this understanding here. So in regards to being able to reach harmony and balance, these are some critical questions that we are encouraging folks to ask themselves during, even before, during, or after this policy process here. And some tribes probably already do this here, so this is not new information, but what we, again, are trying to do is at least structure this and organize it so other folks can be able to have this serve as a guide. So when you're thinking about your policy, how will your policy holistically incorporate the community level quadrants? So again, that's thinking about all of those forces and factors that are in those community level quadrants within the past slide. And some people already do that when they're creating policy, others don't. How does your policy consider variables that may disturb the balance within the community? And if you know your community well, you know that there are forces and factors that disturb the balance, such as maybe tribal elections, for example. That's one thing that pops out right away that could disturb the balance. Or maybe a lack of service providers could maybe disturb the balance when trying to fulfill a healthcare delivery. And then the last bullet here is what factors can come into harmony and allow the community to achieve its goals and perform with excellence. And so this is more looking at maybe the available resources or the current strengths that are already in the community. Maybe how can you tap into those? How can you be able to utilize that and be able to create harmony and to be able to influence a harmonious relationship within those community quadrants there. So I want to move on to an example here to get more into what we are trying to communicate.
So for the policy example we're going to be using is the traditional tobacco program and policy. And so kind of looking at the quadrants that Adam was just talking about and how those come into play. As you can see on the screen, we kind of wrote out different ways that they can touch on that. But basically, in summary, is that the policy will help balance out the imbalance of possible commercial tobacco use, or to reintroduce traditional tobacco if that was a tradition for your community. And we know that not all tribes use tobacco traditionally. This tribe in the Northwest does, and so they were able to try and take that back and grow their own tobacco with seeds. And they are doing this, and through this process, they're helping educate on traditional tobacco and the dangers of commercial tobacco use to decrease commercial tobacco use throughout the community and to improve the health of the community as a whole. And this is done as kind of with the infrastructure of partnership and relationship between the tribe, the community, and the culture center, and being able to pass out stipends while educating the community through this and teaching youth how, and other tribal members, how to grow tobacco and being able to use it traditionally versus commercial tobacco, and using it for ceremonial purposes as a thank you offerings and other forms that they may use it for. So that's kind of how this kind of works in those 4 quadrants. And at the bottom with the kind of the most, one of the important pieces is just kind of policy honors the cultural traditions and community norms. And so within the policy, it has specific information through the community and community language as well.
So this next example here is something that has been done by tribes across the country, and that's incorporation of traditional, customary, natural law, and common law within a tribal justice system. And this is something that really is adapting something that is, again, probably already natural, or at least just something that has been used traditionally. And when anytime there is an intervention that is maybe integrated into maybe a some sort of service delivery that relates to a tribal culture, you're certainly going to have a variety of benefits and positive impacts and balances. So with the incorporation of tribal customary natural law and the environment piece, it strengthens sovereignty and fosters sovereignty and self-determination. Within the infrastructure, utilizing natural law informs the cultural protocol that is already natural to the indigenous population. Within the resource area, elders can have a purpose and a role, which elders often already serve in this capacity here. It's just more formalizing it as well, and of course you have youth that could take part of this and be have this as a way to teach youth how the traditional justice system protocol is within that society there. So you're going to have that benefit, and the mission, of course, is just being able to respect the spiritual realm and really fall in line with tribal protocol, which again is very holistic, and there's a lot that is considered. So this is just a pretty easy example, and we'll have more examples within the toolkit when we plan to release it. And I do want to mention about the community quadrants is that it's going to be released with the information that you saw on the previous slide. But what we're also trying to encourage is that tribes use this guide and also start to integrate their own sort of forces and factors in their community, or their own tribal protocol, or their own customs, their own language. So this is sort of at least just a very general guide that tribes can then adapt it and then tailor it to their own customs, because what we're trying not to do is really have one sort of set of tribal customs or be very partial or biased to a particular tribal practice, but maybe have more ideas that are broad-based, agreed upon, like the relational worldview. So at least just want to mention that, moving forward.
Yeah, and that really explains too our thought behind this approach, right? So we do have, you'll see in our next slide in a minute, that in our policy phases or the policy process, that it aligns with the mainstream policy process, not because we think that's necessarily the one and only way, but that there's a way that we can holistically and culturally relevant ways of adapting the policy process to really work for our communities. And we come from again, a very community-driven perspective. We want to make sure that we're giving communities ownership over these policies or the programs or the solutions for their communities, because that's how, A, you're going to have community buy-in, and 2, that's how it's going to be successful and effective. Many of the phases are from real examples from our tribal communities here in the Northwest. We do a lot of policy work with them. And so you'll see too in the toolkit when it's released, we have some policy templates in there that have been de-identified, that the tribal names won't be in there, but it gives you an idea or, one way that you could write a policy, say for smoke-free housing or for a healthy food meeting policy, something like that. But the idea is that there's no cookie cutter way of doing this work, as a lot of you probably already know if you're already doing policy work. And our toolkit really serves as a guide. It's not going to work the same way for everybody. Each tribe is different. Every situation is different. Even if your topic is the same, it'll vary from community to community on how or what would be the best solution. So on this slide, we just wanted to show the phases of our policy process, starting with identify, imbalance, and engage stakeholders, and moving into research and planning, so on and so forth. We're not showing the quadrants within this image, but in the layout of the toolkit, after each phase, we list out those quadrants and just some initial questions that you may want to ask yourself as you're going through each phase. For example, say you're in the research and planning phase. This is where you're gathering the best practices that may fit for your community, developing a plan for how you will present, how you will implement your policy, but also something to really think about is how are you going to evaluate your policy? As you'll see, one of the last steps after implementation is evaluation. That's not the point in when you're planning how to evaluate. You're planning your evaluation closer in the beginning stages, because you're going to need to know what is it that you're going to measure to see if it's effective or not. Also, something we wanted to mention is that maybe you're coming at it, you pick up this guide and you've already identified the need of the community, and you already have people that you're working with, whether it's coworkers or other tribal departments or other community members that are going to help you write and push for this policy. And you're really just needing some help or guidance around writing or more on the implementation part. So you can start at different parts of the guide or the phases. And it's important to know that you might have to, it's a feedback, you might have to revert back to another phase. For example, in our image here, after evaluation, if the policy is ineffective or does not address community imbalance, you're going to have to revise and re-implement. So it's not it's not a linear process, right? So it's going to look different for everybody, but we just want it to be sort of a guide, some starter questions to get you thinking. We provide some various tools in this guide that will help you with assessments, and Ryan will talk a little bit more about what those tools look like and how they may help you. But again, there's definitely no one right way of doing this. There's no Unfortunately, no cookie cutter way that's going to work for everybody, right? So, yeah, I think that's all I wanted to say.
So you can see here, I'm not going to read off each one, but the bulleted list here are the actual tools that will be in the toolkit. And I'll just maybe talk about two of them as examples, but environmental scan for one. So we created our own for tribal communities based off of a basic one we had found online. But it's just something everybody in the community can even do as a group. We would give them to community members. We would walk around outside, and if we were talking about tobacco policy, there might be questions on there such as, are there no smoking signs posted? If there are, do you see cigarette butts on the ground? Do you see people smoking, or is that considered unacceptable? And so it just goes through these like things that you physically would see in your environment, and at the end what you could do with this is tally up results to see if even a tobacco policy should be implemented, and it would also help say like what should be implemented based on your findings. Writing considerations, it's just going to talk in there about how you might incorporate like language and culture, as was already previously said. Some of these are a little bit more basic, but we definitely, as Adam had also mentioned, these are templates that we have either created or tribes have used. And so these are just examples of ones that we created, but we always say in there, first, always go and look at policies that your tribe already has, because you might want to use that as a template, but you just may need help with some new language in there. So definitely always utilize your own tribe as a first priority. And then if you don't have any though, this would be a good way just to get an idea of what that would look like. And then I'll just mention community readiness really quick. So what I found whenever creating this group was these tribes who really wanted to do bigger policies like smoke-free tribal housing. We found that you just can't pass a resolution, and we basically had to get community buy-in, and so that's done through the community readiness, because if the community doesn't even know it's a problem, they're not going to be ready to implement this whole entire policy. So just gauging where the community is might even tell you if they're not ready, they might actually need more education first before you would follow through the policy. And then stakeholder engagement, just there's a great checklist, or not a checklist, but a list in there of people in your community who you should engage and what their role could possibly be. And that's a good thing to look at if you don't have enough buy-in from people in your community. Just second, thinking about who's all in the community and how can they help this process.
One thing I wanted to mention about the tools and the resources that will be shared in the toolkit is that we've tried to hone in that central theme of a holistic lens and using community quadrants, looking at the environment, looking at the infrastructure, looking at resources and missions. So that's what you'll see throughout a lot of the tools and resources that we have developed and tweaked to be able to reflect that tribal perspective.
So moving forward, I love this picture that Adam put in here. So right now we're in the process of getting additional feedback on our policy toolkit. And then we're going to be revising and editing. And then next month, we're going to be presenting to our health delegates at our quarterly board meeting. And after that, we're going to allow, or during that, we're going to allow the community, get community feedback vetting from our tribal elders. And again, more editing coming too. And then hopefully have this completed by early spring of 2018. And then after that, we're going to try and pilot this toolkit to 2 to 3 tribes. So I guess if you guys know anyone who would like, or we're going to look mostly close in our area for travel purposes, and just try and find one of some of our Northwest tribes. So if you any Northwest tribes that are on here who would like to pilot, just keep this in mind that we're going to be looking and searching for some who are wanting to do this together. And that is the end of our presentation. We are very thankful to be on here. So thank you, Shannon, for reaching out to Ryan and Adam and getting us on your guys' webinar, and we are happy to answer any questions you guys have as well. And we will be putting up our contact information if you don't have any questions right now, or want to look more at the tools or resources or anything like that that we are able to share with you. We're not able to do all of them at the moment, but we have a few that we already give out to our tribes. So we're happy to share those with you in any way. And yeah, any questions?
I have one question. Would you guys be able to share this PowerPoint with us so that whenever we send out the recording, we can send out the PowerPoint with it?
Yes.
Yep.
Okay, great. Does anybody else have any other questions for our presenters?
Is there any way you guys can email out the toolkit?
Well, yes. So the rollout plan is that once we have it finalized later in spring and we are ready to pilot this, that we're going to actually have it on our website as well. So it'll be electronically available. We'll have a resource library through the Northwest Portland Area Indian Health Board that people can access this. And then, yeah, if you have specific requests. But Adam, did you want to add?
Yeah, I think with the tribal communities that I work with, the systems of care and our partners, yeah, we'll definitely have a way to share this, especially with our tribal grantees with the systems of care. So there'll be a way. And is this Ashley Lincoln from Cherokee?
I'm sorry, yes.
Hi, how you doing? I will definitely follow up with you after this to provide you with some more detail about it and just share some ideas. But yeah, we'll definitely have a full rollout plan, and which should be released spring 2018. But we could talk more about assisting you with any policy needs that you have.
Okay, awesome. Thank you.
You're welcome.
We have a question in the chat that says, what was the toughest part of getting the community engaged? So what are some challenges that you guys faced in your own community when implementing this?
Well, who wants to start?
I guess I'll at least just start and well, because I want to mention that we have a portion of the toolkit that we are highlighting some of the challenges but also some potential strategies to address some of the challenges, because we all know that there are certain challenges to policy, such as tribal politics. You know, that's one big thing that comes to mind right away when we're talking about, tribal communities doing something, within their community. That could be somewhat of a challenge there. So we do have that as a portion, which I can allow my teammates to elaborate more on.
Some of the things that I've noticed a lot is with community engagement is being able to get the numbers that you're wanting. So getting people to come to those focus groups or come to those community meetings sometimes, especially if the topic is a little taboo and there's like this uneasiness of talking about it. And then that, like Ryan was mentioning, that goes back to educating the community and honoring those values and perspectives. But Ryan or Netta, did you have some examples, like when you're working with the tobacco coordinators?
Yeah, so piggyback off of both of them, just working with tobacco locks. That's part of my job that I do, is working with the 9 tribes of Oregon on tobacco prevention and education and helping them try to pass policy within their community. And some communities, aren't full, kind of what Ryan was saying, that going through the community assessment and readiness is that some of the tribes are uninformed, and just the education of the dangers of possible secondhand smoke and maybe even possibly third-hand smoke, and just kind of getting the education built up and then going from there with policy. And part of this that we've talked about is that maybe policy isn't the solution. And so a policy wouldn't be needed for this. Maybe that also beefing up the policy, going from maybe no smoking within the building to having a 25-foot rule, to expanding or even adding electronic nicotine delivery systems, since that is something emerging and new. So having tribes update their policy, it takes a lot of work to just add that extra bit. There's a long process that needs to be done. So trying to just education on there as well.
I would say, like a lot of times we've been creating, tribes say, okay, I want to pass this tobacco-free policy. And so what we do is we get a community readiness survey, or sometimes it's even just a really simple survey depending on what the tribe wants. And yeah, sometimes they don't get as many people as they thought they would get. So I also think, you know, which is part of this toolkit has in there, is though how to like gather up your troops, and that's going to be through your community champions, how to get everybody together. Like, are you going to offer food? Are you going to have childcare? But after you get these, let's say then you get a lot of surveys done. So here's the other problem is sometimes like, what after that? What's the follow through? What are you doing? Are you like, if some people, if they're not writing up a report based on their findings, sometimes it just sits vacant and nobody knows. But it's and in the policy toolkit we have that. What do you do with the information? How do you write up a report to then present it back to the community or to your tribal council to say that it's a problem and we need to create change? So I think really is like getting the people, and then, you know, the follow through of what you do with the information that you find, because then if you don't present back, sometimes it will just kind of get pushed behind.
So I see another question that came through. It says, does your team or program offer any type of policy trainings or advocacy training with community members to prepare them for tribal politics? That is actually one of our hopes, along with, well, not the tribal politics, but right. So just the policy trainings or advocacy piece. We are hoping through our piloting part is doing that through a hands-on workshop. And yeah, I mean, that's the hope, is that we're going to be able to provide more of that TA. Yeah, more of like a curriculum, I guess.
Which then people can go back and use in their communities to train members to sort of get their teams together.
Yeah. And we can always brainstorm and like just have a conversation of like, how do you navigate some of those tribal politics, or get people, like part of our TA, the technical assistance we provide here at the health board, is when people are having an issue, maybe, you know, connecting them with people that are other tribes that we know have dealt with similar politics or similar barriers, and just kind of get them connected so they can collaborate and share and brainstorm together ways that have worked for them. But
sometimes brainstorming your barriers too, and what the community sees as barriers really helps you sort of map out then, if this is barrier, why it's barrier, and what can we do to get over it, is really helpful.
Yeah.
And that's in the toolkit too.
Right. And something that I've been told too is that maybe when you're engaging your stakeholders and really getting that list of champions to help you with this, is they can help you present too to your committees or your council, especially when you get the youth involved. Because if the youth are saying, this is something that we want to see change in and we want to be a part of it, I think councils are a lot more open or to that. So it's worked for a lot of communities that way, or your elders, you know, just community champions.
And that's what's great about this toolkit, I think, is that it's taking that holistic look and looking at all of the interconnected factors and forces that are in a community that could, you know, you could then manipulate or tweak in order to get more community engagement. So that's what's great about the relational worldview and this framework, is that, again, it looks at the big picture and really allows you to see the interconnections and the relationships between all of these forces and factors. So I feel like anything that you bring in or try to integrate, such as youth, that's going to have a positive factor in all the other aspects there. if you bring more capacity and training within the infrastructure area, that's going to have a positive impact and create more balance within those forces or factors in those community quadrants there. So you could utilize, and we at the National Indian Child Welfare Association utilize the relational worldview to assess those imbalances, to assess strengths, to assess resources, to assess, the environment and what is needed in order to, restore balance with maybe the challenges that you're facing on the ground.
Thank you guys for that good answer, and thank you for sharing your perspective and your experiences as you've worked through this. Us here at the Great Plains Tribal Children's Health Board, I think many of us who are on can relate to those struggles and those the work that you're doing. So we appreciate you for what you do, and we appreciate you taking the time out to share with us today. I would like to apologize to anybody who got the wrong link and had to get on late, or if anybody invited somebody and they accidentally, it was a mishap. We don't really know how it happened, but this webinar is recorded, and I'll be sending out a link to the YouTube. This will be on our YouTube channel, so you can share it with anybody who came in late, or if they weren't able to get on because of our mistake. We apologize for that. Just a few things as we wrap up. Please fill out the evaluation. You can find it in the chat box. I already posted it. It'll also be a part of the email whenever we send out the video link. Again, if you would like to receive the link from us and you're not on our listserv, please put your email address in the chat box so that we can be sure to get that to you. And if you'd like to receive notifications for any of our future webinars, we would love to have you. And as soon as we get our updated flyer ready for the January webinar, we will send that out. And just so you know, our next presentation will be by our own Kendra Rowland, and the topic will be cervical cancer and HPV 101, presented by Kendra. She runs our breast and cervical early detection program here at the Great Plains Tribal Chairman's Health Board. So if there are no final questions, we will finish out the webinar here now and let you all go on with your afternoon.
Thank you for the great presentation.
Thank you, guys.
Thank you. Take care.
Thank you very much. Have a great afternoon.
You too.